Today I'm joined by Mila Kofman, who is the Executive Director of the DC Health Benefit Exchange Authority, a private public partnership responsible for the District of Columbia's Affordable Care Act online health insurance marketplace called DC HealthLink. Mila, thank you so much for taking time to talk with us today and answer some questions about how cancer survivors can do their research to choose the best health insurance plans for them. So,
Thanks for having me.
thank you. So my first question is, can you just give an overview of how the health insurance marketplaces work, including healthcare.gov and then state and district-based exchanges like the one that you run?
Sure. So every year, state-based marketplaces and the federal marketplace have an open enrollment period. And that's the time when anyone could come in, choose a plan that's best for them, and get coverage. That's also the time when consumers can find out if they're eligible for lower premiums. So it is very important to know when your state's open enrollment period is. If your state is on healthcare.gov, it's super easy. Just go to healthcare.gov and you can find out what the open enrollment period is and what options you have. Every state-based marketplace has our own time frame, and it's different than healthcare.gov's for some states. For DC HealthLink, we have a very long open enrollment. People can come in as early as November 1, and then we close open enrollment on January 31st. That is longer than in most other states. It is definitely longer than healthcare.gov. So I don't want anyone to miss this annual open enrollment period where you can come in and get covered.
Thank you. So if you don't know whether you're in a state that's on healthcare.gov or has its own exchange, what is the best thing to do?
The easiest thing really is go to healthcare.gov, and if your state has its own exchange, then the healthcare.gov website will direct you to your state's marketplace. That is really the easiest way to find out.
Great. So what advice do you have for a cancer survivor who wants to choose the best plan to meet their needs for both cancer treatment and post-treatment care?
So there is no one size fits all plan, right? Each of us has a different need in different financial circumstances. The least expensive plans have lower premiums but higher out-of-pocket costs, like annual deductibles. In many cases, higher co-payments, higher co-insurance. So it really depends on your financial situation, what plan is best for you. Sometimes it's best to have low out-of-pocket costs, right? If you have very expensive medical conditions, if you're undergoing chemotherapy, for example, you may want a plan that has no deductible and very low out-of-pocket costs, but your premiums will be higher. So that's something to keep in mind. The easiest way to shop for health insurance for cancer survivors and others alike is really what I call anonymous shopping. Pretty much every state-based marketplace, and I believe healthcare.gov also has anonymous shopping. All you have to do is go online and answer a few questions, and then it really, literally seconds, you'll get some options. For us in DC, our anonymous shopping is called Plan Match. All you have to do is put in your age because premiums are based on your age. And then it asks you questions whether you plan on having certain medical procedures like knee replacement surgery, those kinds of things. It gives you an option to put in medications that you're on. So not only medications, but also the dosing. And you don't have to, but you can. And then you can put in all your doctors if you want to, but you don't have to. And then instantly you get a list from us. and it tells you what your premiums might be, what in a good year or in a bad year your health claims may be, and it really helps you make a more informed decision. And this is all even before you set up any kind of account with us. You can just go and see what's out there. And it gives you everything: co-pays, co-insurance, how your doctors are covered, formulary, how that works for the particular medication you're on. So that is really my best advice to anyone shopping for health insurance. Use anonymous shopping.
Thank you. Now, can you talk about the role of insurance navigators, and if somebody doesn't feel comfortable using the anonymous shopping that you're talking about, or needs help understanding what the terms mean and the different options are and comparing options, how can insurance navigators help, and how does one access these navigators?
Sure. In most places, you can get in-person help, and you can get help by calling a contact center, or you can go online and do everything yourself if you wanted to. So there are different types of in-person folks who can help you. We call ours DC Health Link Assisters or Navigators. We also have insurance brokers who are certified to help you. We have a list of everyone who we've trained who's available. We provide you with information about their language. So if your preferred language is Spanish or Amharic or French, you can actually get in-person help from someone who speaks the language of your choice. So it's very easy to find expert help. And each state has their own team of people who they train and certify. And, these are the trusted people you can go to and get real help.
Thank you. So, what about, you mentioned insurance brokers? Can you talk about how they're different from navigators? And I know that there's been some news about some challenges of insurance brokers and the incentives that they have. And so, how can a consumer kind of protect themselves to make sure they're getting the right advice and that they're getting the best plan for them?
Yep. Well, first of all, whenever it comes to sharing any of your personal information, you have to be very careful, and you have to get an expert advisor. The big difference between insurance brokers and navigators is that insurance brokers tend to get paid through commissions from insurance companies. And navigators or assisters get grants from state-based marketplaces or the federal marketplace to provide consumers with assistance. In both cases, the help itself is free. So the consumer is not asked to pay anything. And that's really important. If a consumer is being asked to pay, run. That is not okay. All of this expert help is free because someone else is paying for it to provide free help to consumers who need assistance in choosing a plan and enrolling in an ACA plan. We have all been reading the same news that there's some fraud with some brokers, and there are always bad apples out there, but it doesn't mean the whole industry is bad. We work with great brokers, and this is probably true for all state-based marketplaces. We train brokers, we certify them. We make sure that they have all of the right information to help our consumers. And all of our brokers have to be certified by us. No broker is allowed to help our customers without being first certified by us. We make sure they're licensed and trained, and we make sure that they have what we call appointments, meaning they can do business with all insurance companies, because we want to make sure that there's no steering, that if a broker is only doing business with one insurance company, they're not showing you all the options you have. So to avoid those problems, we require that the broker is appointed with all of our insurance companies so you can get all the options available to you. But if you're not sure if the person you are getting help from is authorized to help you, the best way to find out if they are is either to ask your state's insurance department if they're licensed to do business in that state by the insurance department, and also to find out from the state-based marketplace whether they're authorized to do business through the state, and the same with healthcare.gov.
Great. Thank you. So if someone already has a plan through the state exchange or through healthcare.gov, what do they need to do during open enrollment to make sure that they have the right coverage for the following year?
Most of the time, nothing. It just automatically renews. However, if you are getting lower premiums, and many of our customers are, thanks to the Inflation Reduction Act, some of our premiums are as low as $13 a month. Lower premiums are based on one's income. So it is very important that you go into your account and update your income information if your income information has changed. Because it may be that your premiums for next year could be even lower. For instance, if you've had a drop in your income. And so just make sure all of your information is correct so you can get the lowest possible premiums. But otherwise, you don't have to do anything. If you're happy with your plan, you're all set for the most part. You don't have to do anything. I do want to add something that I'm always asked about, and that is every year the plan benefits change, right? And so you might be happy with your plan, but just make sure that you look at the notice, the renewal notice that you receive, that will have information about not only next year's premiums, but also benefit changes. And if you don't like either the premium or the benefit changes, then shop. Most people who shop save and get a better deal.
Great. And how does the consumer know that they're getting all of the assistance that they are eligible for based on their income? Because, I think sometimes people think if you don't already have insurance through the marketplace, think it might be too expensive. But as you said, sometimes the premiums are extremely low because they can qualify for additional assistance. How do you make sure you're getting all the assistance that you're eligible for?
Most state-based marketplaces have a very quick way to help you figure out if you qualify for lower premiums. For instance, in our anonymous shopping, the plan match tool, when you put in your age and any medical procedure you expect to have, we also ask you a question: do you want us to tell you whether you may qualify for lower premiums, or even Medicaid, which is the public insurance program? And all you have to do is tell us your household size, like if you're one person or two people or more, and an estimated annual income that you have for your household. And instantly we tell you, you're likely to qualify for Medicaid, or you're likely to qualify for lower premiums, and here's how much you can save. And here, when you look at the list of plans you qualify for, we show you how much you save for each one. So in most cases, in our case, in less than a minute, you can figure this out. It's not going to be the official determination, but it will give you a good sense whether you can qualify for lower premiums and what your premiums may look like. And then we have the online application. It's up to you whether you want to fill out the quick one and just pay full price, or if you want to give us some income information so we can officially tell you about your lower premium, and then your monthly bill will be that lower bill. So it's super easy. And the way our online application works, it's very much like TurboTax. You don't have to finish everything at once. And for most people, it's really quick, maybe 15, 30 minutes at most, to get yourself enrolled with lower premiums. And if you're paying full price, some people have done it in like 5 minutes. It's very easy.
Great. Thank you. So one issue of concern to many cancer survivors is ensuring that the cancer care specialists that they need to see are in network. And we know that KFF recently released a report about network adequacy that found that a marketplace enrollees had access to 40% of the doctors near their home through their plan's network, with considerable variation around that average. And they also talked about limited networks for some specialists, including emergency physicians. So, what advice do you have for people who are concerned about whether the providers they need for cancer care are in network?
Okay, so first of all, just because your physician is in network today, it does not guarantee that she will be in your network tomorrow. That's a problem everywhere. It's a problem with all insurance, ACA products are not just like every other insurance product. It's just a problem everywhere. But one way we encourage our customers to figure out whether or not their doctors are in network is to use our plan match tool. Once again, put in the doctor information and make sure that they're in network. And then if you really want to double and triple check, call the health plan and ask and make sure that, yes, that physician is in your network. So in this area, and I know it varies around the country, narrow networks or limited networks actually are not very prevalent. In fact, people who live or work in the Washington area, Washington, D.C. region, many commute from parts of Delaware or Pennsylvania. And so the networks in this area tend to be very broad and cover not only physicians and clinicians who are in DC or even the Metro DC area, but much broader. It does vary around the nation. I lived in Maine for 3.5 years, and Maine is a great example. Parts of it are very rural, and it's hard to find providers and specialists. So it does vary, but check your state-based marketplace website, check healthcare.gov. You can get a sense of who is in your network, and then double check, call the health plan and find out.
Great. Thank you very much. Are there any other tips or pieces of advice you have for people trying to choose plans that we haven't already talked about?
Uh, so every year we have new product design where we're looking for ways to improve what our customers get in terms of benefits. And we have products called essential standard plans. And essentially what they are is many services that patients need are without any deductibles in those plans, no matter what level you decide to purchase, bronze, silver, gold, or platinum. And so services like accessing your family doctor or your specialist or urgent care or generic prescription drugs, none of those have deductibles. Even if you're signed up with a bronze plan that tends to have very high deductibles, those deductibles do not apply to essential care like urgent care. And the number of visits with your specialists, including mental health providers, by the way, as well as your family doctor, there's no limit on the number of visits. Deductibles just don't apply. And that way, we can make it easier financially for people to access basic medical care. And in our case, our products are equity-based benefit design, which means certain conditions have no co-pays or co-insurance or deductibles. So, for instance, type 2 diabetes, completely free. So, free insulin, free doctor's visits, annual foot eye exams, lab work. Uh, Pediatric mental health is $5 in those plans starting next year. Heart disease, high blood pressure, stroke, outpatient care, no cost sharing. So that includes CT scans. So for certain conditions, we've eliminated financial barriers altogether to getting care. I just want to throw that in there because sometimes, we all know a cancer survivor, right? Cancer is not the only medical need that our friends and family have. They have other conditions that they have to worry about, and it does get expensive. So I would encourage shoppers to be smart and look for benefit design that helps them with all of their medical needs, not just one particular one. And in our case, our essential plans actually make things a lot more affordable, especially when there are no deductibles for many services.
That's wonderful. Well, thank you very much for your time and for explaining things so clearly for to help consumers as they do embark on this shopping and figuring out what plans are best for them this year. We really appreciate it.
Thank you so much.